Here in Germany, there has been a surge in COVID-19 deaths over the past month. More than half of all deaths in the entire pandemic were recorded in December. Calls are now growing louder for Germany to extend its current lockdown. Chancellor Angela Merkel is due to hold talks on Tuesday with leaders from Germany's 16 states to discuss that lockdown, which is set to end on January 10th. A leading doctors' union is urging for an extension, saying the health system is in desperate need of relief. For more, I am joined by Dr. Uwe Janssens, head of Germany's Critical Care and Emergency Medicine Association. Dr. Janssens, really appreciate you joining DW. A record number of deaths in December. Just how dire is Germany's situation in terms of intensive care beds?
Yes, the burden is still very, very high, and it is the result of very high infection rates all over November and December. And the burden on the intensive care units is the result of this light lockdown. I'm very much convinced about this. So we were happy to see the hard lockdown in December, and at the moment we are still working on the high tolls we got from the light lockdown. So first, second, the Christmas Eve and the days between, many people came together, and we don't know what will happen in mid of January as a result of Christmas Eve and the New Year's Eve. So we will see what will happen.
So, yeah, we have to wait to see what else might develop here. One of the big stories during the first wave of the pandemic was Germany's success in dealing with the virus, and a significant factor was the country's intensive care capacity. What's gone wrong here, Doctor? Is it simply, as you refer to, the unexpected spike in numbers, or is there something else?
No, I think it's quite easy to explain. We have very high intensive care unit bed capacities. We are champion leaders in ICU beds. You see, we have 33 per 100,000 capita ICU beds. For instance, in the Netherlands, it is about 6 to 7 beds per 100,000 inhabitants. So it's not the number of ICU beds, it's the number of infection rates which goes at this moment that will lead to this very, very severe burden of critical ill patients. And as you know, in Berlin, for instance, we have a very high number of COVID-19 patients per ICUs. That's above 35%. That's quite a lot. In other areas of Germany, that's between 10 and 20%. So it's the result of the high infection rates, and it's not that we don't have enough ICU beds.
There is so much more I'd love to discuss with you, Doctor, but I'm afraid we're out of time. Really appreciate you joining us. Dr. Uwe Janssens of the German Critical Care and Emergency Medicine Association. With me in the studio is DW's Chief International Editor, Richard Walker. Richard, welcome. More and more German politicians and doctors are calling for an extension of this lockdown. Are those calls justified?
Yeah, well, I think an extension of some kind, at least, is looking very likely when politicians meet during the coming week to talk about whether to go beyond the 10th of January, which was the plan until now. And what's driving that is very much the health system you just mentioned there, because the actual kind of infection numbers that we've been looking at over the last week, 10 days or so, aren't at their peak levels, but that is partly being driven by the fact that, of course, over the Christmas, New Year break, there's not so much testing going on. The health authorities, the local health authorities, not passing on so many numbers. But what is happening, what you really do see, is the health system getting close to the brink of what it's capable of delivering. And there's one example here in Berlin. If you look at the number of people in intensive care in Berlin hospitals, 34% of Berlin's intensive care hospital beds are taken up by COVID patients right now. Just 1 month ago, that was 24%. So that's a very significant jump just during the course of this past month. And of course, what German politicians are really worried about is the German healthcare system hitting the kind of situation that we saw in Italy and Spain in the early part of last year, where in regions of those countries, the health system couldn't cope any longer, and then they had to start turning away some patients from the care that they needed. That would be a scenario that no politician here, I think, wants to get the blame for. So I think that is driving this kind of sense that politicians are likely to err on the side of caution when they next meet.
The cautionary tale that's towering over all the thinking here. Would it also, this second lockdown, affect schools and kindergartens?
Well, there is debate around that. So there's a lot of pressure for schools to reopen at least partially, so that children can get back into education, because, you know, there's a growing awareness of the psychological impact on children of being cut off from really good quality teaching in schools. But there's also a growing awareness that schools do play a role in infection. So, you know, one suggestion that has come up is, for example, to allow younger children back into school, but for older children to be still at home, older children being both more independent and capable of working from and doing their studies from home, and also potentially posing a higher risk if they did go into school. So you can expect some debate around that this week, that's for sure.
Richard, briefly, Germany started its mass vaccination program on December 27th, of course. I think it's safe to say it hasn't gone very smoothly.
That's right. I mean, there's also a huge debate opening up around this. You know, there was a lot of excitement just before Christmas when these vaccines started getting approved. You know, there's the BioNTech vaccine that was also developed in Germany getting approval. These huge vaccination centres being opened up in concert halls and airports around the country. But these don't have enough vaccines to actually get properly to work.
Right.
And the head of that company, the CEO of that company, BioNTech, has actually come out and said, why didn't the European Union order more of our vaccine? They could have done. And this kind of goes to the heart of this debate, because the European Union has taken on a very central role within Europe of ordering vaccines. Now, they say, of course, they had to divide up their orders among different companies because they didn't know which one would come through first. But they are facing accusations of not ordering enough. I think one thing we have to emphasize that when discussing this is that, of course, the EU is in the fortunate position of being able to afford these vaccines, which, of course, many countries around the global south simply can't at this stage.
Exactly. DW's Richard Walker. Thanks as always, Richard. Well, India is testing its nationwide COVID-19 vaccine distribution systems as it prepares to roll out an inoculation program. The trial includes the entry of data into an online platform that will monitor vaccine delivery. The dry run comes a day after regulators approved the vaccine developed by AstraZeneca and Oxford University for emergency use. India hopes to inoculate 300 million people in the first 6 to 8 months of the year. For more, I'm joined now by our correspondent in Delhi, Nimisha Jaiswal. Nimisha, India has reported over 10 million COVID cases, second only to the United States. It says it hopes to inoculate some 300 million Indians by summer. Is there any concern about whether the government can actually pull this off?
Well, this is definitely a massive logistical challenge, Michael, and the government has laid out a very detailed plan already. It first plans to target 30 million people who are considered frontline workers. This includes healthcare workers first, and then sanitation workers and security personnel. But the true challenge will emerge when we then move to the other 270 million people that India hopes to vaccinate by the summer, which includes everybody above the age of 50, as well as those below the age of 50 who have comorbidities. Now, this is not data that is currently recorded in an organized manner across healthcare databases in the country. So now the priority lists are being built across the country. People will have the option to enroll on the digital platform called the CoVIN app. They will be given a pre-designated spot to show up and get their pre-booked vaccine. But of course, tracking this data will be a crucial step. And each vaccine center, so far it seems, will only carry out 100 vaccinations per day, which means that thousands of such centers will be needed across the country, working efficiently to hit this target.
India's healthcare budget is only a small proportion of its GDP, yet millions of people have to be reached, including some in remote and rural areas, as you know. What are the challenges here?
Well, Michael, India and the Indian authorities hopes to draw on experiences it has had in the past, even though nothing of this scale has been carried out. India has a robust universal immunization program, which gives out hundreds and millions of doses of vaccinations to young mothers as well as infants. And this has been ramped up significantly over the last decade, which has improved India's cold chain infrastructure, which is basically how a vaccine stays cold from the delivery point till actual inoculation with the patient. In addition, India is also planning to rely on its vast election experience, where millions go to the vote in a single day. It's a similar model in a fashion. But of course, there are significant challenges. The cold chain storage I mentioned is useful for a vaccine like the Oxford vaccine, which requires temperatures of between 2 and 8 degrees. But when we look at something like the Pfizer vaccine, which requires temperatures of minus 70 degrees, this is too massive a challenge in a country like India, and will be much more difficult to pull off. There is also concerns around data management, making sure that people come back for the second dose, following up on observations with people who get the vaccinations, and of course, preventing misinformation.
DW correspondent Nimisha Jaiswal for us there in Delhi. Really appreciate it, Nimisha. Thank you. Let's take a look now at some other international stories. Japan is considering declaring a new COVID-19 emergency after a record surge in cases. The governors of Tokyo and 3 nearby prefectures urge the national government to call a state of emergency to stem the spread of the virus. The government says it must first consult with health experts. French police have been recording the details of revelers leaving an illegal New Year's Eve party in the western region of Brittany. Some 2,500 people from France and abroad attended the rave. It was held in violation of a nationwide curfew and ban on gatherings and continued until Saturday morning.